Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine's Longevity Channel, and today I just want to give you a quick video about the 3 things that people are doing when they get an acute injury that could be stalling or, not contributing to healing. And so I just wanted to address these things so that the next time you sprain your ankle or strain a muscle, you do the appropriate things so that your body can heal correctly the first time and you don't end up with some kind of chronic injury over time. So the first thing that people typically do when they sprain an ankle or they have an injury is they immobilize it. They completely stop using that joint. And while it is important to not go running on a sprained ankle or to, play tennis with a strained shoulder, it is important to continue to move that joint through range of motion throughout the day gently. You don't want to totally immobilize the joint, because if you do that, you can create more issues, because when you stop moving a joint, then the circulation doesn't go there as much or as often. And also the entire structures around there kind of stiffen up. And then when you go to try to use it again, it can be more difficult to try to strengthen those muscles and mobilize that injury because everything started to just guard as much as possible around that area. And if you strain it and then you're mobilizing it throughout the day, just taking it through all the range of motion that the joint normally goes through, kind of warming it up a little bit, before right when you wake up or right before you go to bed, or just kind of throughout the day, making sure that you're not doing anything that's really painful when you're doing that. You're just kind of gently moving it through the range of motion so that really good healing can happen there and growth factors come and blood and circulation are flowing, and we don't shut down that process of movement. It is a hugely important component of acute injury. And the next thing I see people doing is over icing. The inflammation that happens when you injure something can be, it can harm the joint if it's way too much inflammation. Rarely does this happen where it gets so inflamed that is going to damage the tissue. And so there are some things we can do for that. But, if you over ice it, it actually shuts down the acute inflammatory process we want to have happen in that joint, that repairs it correctly and brings growth factors to that area. And so I encourage my patients, if they have an acute injury, you can use some icing if that feels good, but just definitely not, maybe once a day, but not, icing all like for 30 minutes a day or twice a day or something like that. The best thing that you can do is keep that joint mobile and not overusing it, but just gentle mobility like we just talked about. And then, if you feel like it's getting too swollen, or you've had somebody assess it and they kind of said, hey, that's excessive swelling, here are some things you can do, then icing a little bit to help with that is okay, but you really don't want to be over icing, or you could handicap the acute healing process of that injury. And then if you do that, that leads to tendonitis and instability in the joint later on. And so it's really important when you injure something to treat it correctly so that your body can do the thing that it's supposed to do, which is heal it correctly the first time. And so the last thing that I see people doing is taking over-the-counter ibuprofen or Tylenol to deal with pain. And unless it's a really severe injury and you just can't handle the pain, I really encourage people not to do this, especially if you're doing it just to get rid of inflammation. It is not a good idea. It shuts down all inflammatory processes, good and bad. There's good inflammation and there's bad inflammation. And way back when I did a video on this, so please go find it. I believe it's labeled, is all inflammation bad, or something like that. There is acute inflammation and chronic inflammation. And when you injure yourself, you have acute inflammation. If you take ibuprofen, that will shut down that acute process. That is going to help that joint or that injury heal. You do not want to do that. A lot of doctors are still prescribing that as first-line therapy. It also destroys the digestive tract over time. It leads people to have leaky gut and IBS. The side effects of taking ibuprofen consistently over a period of time can be very, very dramatic for people, and it's hard to come back from it. And so there's a time and a place for ibuprofen. I'm not like a anti all the time ibuprofen person or doctor. It's just that there's a very specific time and place, and I think it's overprescribed and overused because it's over the counter and everyone just thinks, oh, well, since I can just go buy it and you take it whenever I want, there must be no like dangerous side effects from it, which is just not the case. Over time, there definitely are, and they go under the radar. We don't address them very well from a conventional medical standpoint. You end up going to see a gastroenterologist for your issues, and that person isn't really going to assess what you've been doing in the past. They're just going to try to treat the problem that you've got, and they're not going to be like, oh, well, you used ibuprofen for a year because you injured yourself, and now we have this problem, let's heal that up. They're just going to say, here's some omeprazole, here's some IBS medication, let's get you a colonoscopy and an endoscopy, let's do all this stuff, when really it was damage from over-the-counter pain meds that you took that should be healed up in an entirely different way than a gastroenterologist is going to deal with that. Not all, but most. So I just also wanted to let you know, that's not the best way to deal with it either. So the take-home message is don't immobilize, don't over ice, and do not take ibuprofen or Tylenol if you can handle it. And if you can't handle it, I suggest the pain that you're in from an acute injury, I really highly suggest you go see a primary care doctor or a naturopathic doctor that deals with sports med, or a chiropractor or a PT or somebody to help assess you correctly so that you don't end up trying to deal with the problem on your own and taking too much ibuprofen in the meantime. And that basically stops that joint from healing correctly, and then you're going to end up in all those places anyway eventually. So it would just kind of cut to the chase to go do that right away if the pain is significant. And then the things that you can do, just a couple little tidbits if you are dealing with an acute injury and you're like, this is frustrating, it hurts, blah, blah, blah. I get it. So make sure you keep moving it. Moving it will help decrease the inflammation in there. Gently mobilizing it, like I just said in the beginning of this video. You can apply diluted wintergreen essential oil. Wintergreen essential oil by itself can be very strong and it can burn the skin a little bit. So you just want to dilute it into like coconut oil or olive oil. If you have sensitive skin, this is not a good recommendation for you. Or other skin issues, like check with your doctor. I'm not your doctor, so if you have concerns, please check with your doctor about that first before you take any of these recommendations or suggestions. So you can dilute wintergreen essential oil in a little bit of olive oil or coconut oil, and you can apply that to the area. It's also a COX-2 inhibitor like ibuprofen is, and it's pretty strong, so you want to, you don't want to overdo that either, but it's excellent, and in small doses can really help. Curcumin and fish oil are also great anti-inflammatories that you can take to help mitigate some inflammation. And if you need, dosing, or you really want a protocol based on whatever your specific issue is, I encourage you to call my office at 206-899-6000. And then the last thing that you can do to help heal up an injury is contrast hydrotherapy. And contrast hydrotherapy is when you take the injured joint, and I would wait 72 hours before you start this. So the first 72 hours, gentle mobilization, maybe applying some topical arnica or some topical wintergreen, diluted to the region. After 72 hours, then you can start doing contrast, which is 3 minutes hot, 30 seconds cold. You want the hot water to be as hot as possible. You want the cold water to be ice water. And if you can't tolerate 30 seconds in there, that's okay. Just do your best. And so you'll put your joint in the injured joint in hot water, and then cold water, hot water, cold water, hot water, cold water, done. So it's 3 minutes, 30 seconds, 3 times, ending on cold. And that will act like a pump. It will vasodilate and vasoconstrict the area, and that will get a flushing out of crap, of inflammatory stuff you don't want in there, and then it will bring in all the good acute growth factors that you do want in there, more cofactors, more micronutrients, phytonutrients, enzymes, like all the good stuff that you want to heal up that injury. And that will, you can do that twice a day, and that will really help heal up that joint much faster and make sure that you heal it correctly and that you don't stop any of your body's natural processes that it takes to heal up an acute injury like a strain or a sprain of a joint. I really hope this video was helpful for you. Please share it with anyone you know who you think could use it. And if you're curious about your own injury, I would love to have a chat with you about it. And again, you can call my office at 206-899-6000. Please like, subscribe, and share below. We really appreciate it.